In this podcast from Chapter 20, we're going to begin our management of musculoskeletal injuries. We're just going to take a brief overview of how to manage an injured skier or snowboarder with a fracture or a sprain or a strain. And that begins as we approach all injured skiers or snowboarders with a scene size up. Make sure that you are safe while you're managing that patient. Eliminate hazards. Perform some scene safety. Move on quickly to managing any life-threatening problems. The mnemonic ABCD helps with that. Airway, breathing, circulation, any change in mental status. D stands for disability. Keep in mind, bleeding is common with musculoskeletal injuries, and if it's severe, it needs to be treated immediately. To do that, you would initiate standard precautions. Make sure that you are wearing gloves, you have ski goggles or safety glasses if it's appropriate, and control external bleeding by applying a sterile dressing and a bandage over the top for compression or further. Always notify dispatch when appropriate. Contact EMS in that case. It may be required that support of the patient and proper treatment requires high flow oxygen. That can be monitored with a pulse oximeter, ensuring that their oxygen saturation is above 94%. And if it's a major fracture, such as to the femur or an unstable pelvis, that high flow oxygen is required in an urgent fashion. Now, something that's a minor fracture, say a broken ankle or perhaps a forearm injury from a snowboarder who's fallen, is unlikely to require supplemental oxygen. Now, differentiating one musculoskeletal injury from another is hard to do in the field. You do not have X-ray vision. Now, the general care of all of those injuries is essentially the same. You are a ski patroller. You're not an orthopedic surgeon. You have a limited bag of tricks that you can work from to immobilize that injury and transport the patient safely. Always protect yourself with standard precautions. Make a plan and then execute that plan. Get the right equipment, call for EMS, call for additional equipment and personnel if needed, and then treat the patient. To do that properly, make sure that you expose the zone of injury. You want to ensure that no bleeding is occurring that may not be visible through heavy ski clothing. The bruising or contusions, the swelling or deformity that you see may help you determine what kind of an injury is going on, and then you can dress that appropriately. Using the correct splint or immobilization device is going to be more comfortable for the patient, especially as we prepare for transport. Always, it's critical to check CMS, that stands for circulation, motor function, and sensation, before and after splinting. If a patient has proper motor function and they can feel their fingers, for example, before you apply a SAM splint to their forearm, and then they feel numbness or tingling afterward, it may be that you've tied the splint on just a little bit too tightly. You can readjust it, verify that CMS is intact, and then move to transport. Ice or snow in a plastic bag is effective for assisting with the pain that they might feel at that zone of injury, but we don't want to apply that directly to the skin. We want to make sure that there's just a thin layer in between. Again, oxygen if appropriate, and always transport to a higher level of care. So the summary is this: protect yourself with the scene size up. Make sure that you are safe working the scene. Protect yourself from any bodily substances with standard precautions, and look at the mechanism of injury so that you can start to formulate a plan. Treat life threats immediately: airway, breathing, circulation, disability, meaning a change in mental status. Look carefully at the chief complaint, where that zone of injury is, expose it, even under thick skiing clothes to ensure that no bleeding is occur. Plan your treatment, execute that treatment by immobilizing the injury, and transport the patient.